Hello and welcome to session 3. I hope that you found session 2 enlightening, where I explained the causes for CFS. Now, if you still don't have a full understanding, I would suggest that you watch session 2 again so that you feel comfortable with the explanation I went through and that you are now ready and willing to retrain your amygdala. It is really important that you watch today's session, which is a testimonial session, and that you watch it before session 4, which is one of the main retraining sessions. It can be tempting to watch session 4 straight away, but please bear with me and watch this session first. Before we get you to retrain your amygdala, it's important that you put yourself in a place to give this program your 100% commitment. And as I mentioned in the first session, the observational study on these techniques has been incredibly successful. A lot of people are getting 100% better using this program. So in today's session, I'm simply going to introduce you to people who have successfully been through amygdala retraining, so that you can see for yourself the powerful effects it has had on so many people. The people today are just a small subgroup of the numbers of people who have got better using these techniques. And I'm sure that by hearing other people's stories of recovery, this will powerfully help you feel that you really can do this, that you really can get better from CFS. Many people already have, and so can you.
Hi, my name is Thomas Henry and I've been suffering with chronic fatigue for what I believe for 3.5 years. But possibly it started when I was 16. I used to get glandular fever type illness lasting between 1 or 2 weeks every 9 to 12 months, and that continued until I finally sort of fell over into complete full-blown chronic fatigue, as I said, about 3.5 years ago. At the time, I was breaking up with my business partner. We were having problems with the business. I was working in London, the business was in Australia, and I was working 6-7 days a week, 12 hours days in my current job at the job at the time in London. And then I had to fly back to Australia, finish and close all the business relationship and all the business, shut it down in 1 week, and then flew back. And then I got the typical glandular fever type illness, but unfortunately my boss wouldn't let me have time off work. So then my health just deteriorated from there. It went down and down and down and down until about 4 months later I just couldn't get out of bed at all. And the symptoms I was suffering at the time was, well, obviously extreme fatigue. I was unable to get out of bed most days of the week. Occasionally, if I could, it was only between 1 and 2 hours a day. My pain levels were basically unbearable, going up to between 9.5 out of 10 on some occasions. Also, I lost the ability to be able to think properly. I guess you'd call it sort of brain fog, which was very disconcerting, and it also added some anxiety to having to go out into social contexts or seeing doctors or to explain what was happening to myself, because it was difficult to be able to voice what was actually occurring to me at the time. Also, doctors were very unsympathetic. They just simply said that I was depressed and needed to get out of bed and get on with my life. And I didn't feel that I was depressed at the time. I was trying to get out of bed. I was trying to go and see friends. I was trying to actually play cricket at the time as well, but it was just not possible. So that was very disconcerting from the doctors saying that to me, and I didn't know where to turn at the time. Without the doctor helping me, finally I was able to get him to give me a referral to a chronic fatigue centre in London. But unfortunately then they found some problems with my bloods. My vitamin D was low, obviously, because I hadn't been outside in the sunshine for a couple of years. And on being on that waiting list, then that took another 12 months. And then finally, because I moved location to Brighton, I had to go to the back of the queue again at the NHS. So in desperation, I started looking on the internet for alternatives, and I'd heard about Ashok, and I gave him a call, and he was fortunate enough to allow me to come into his study group. It was at that point that I learnt about what was probably happening to me, and now I completely believe in the process and would recommend it to anyone. So after I had the first session with Ashok and I was putting the techniques into practice, after a couple of days I saw a real change. My fatigue levels were a lot lower, my anxiety and stress levels were much reduced, and I continued obviously with this process, and after a couple of weeks I saw even more improvement. After a month I saw greater improvement, and then even though I had a couple of days here and there that I wasn't feeling as good as I had the previous day, it was still much better than I had on my very good days before I'd met Ashok and started this process. And then I've been able to diarise everything, and everything on a month-to-month basis I've seen increased improvement. And now I'd say I'm 90% better, and I've been able to transform my life, actually get my life back. I'm looking to start some test marketing for my own business in 2 weeks and hoping to launch that in a month. Again, it's just going to be part-time to begin with, looking at doing that 2-3 days a week and looking to gradually increase that as I feel I'm comfortable and my health warrants or allows myself to be able to increase it. So I'm just so grateful to Ashok and this program in basically giving my life back when at the NHS and no other one was really there to help me at that time. If you find yourself in a similar situation to me, what I'd firstly say is you need to be a little bit selfish. You need to put yourself number one. And in doing so, being able to use this program as a springboard to being able to get better. It absolutely works. There's no tricks, there's no nothing. It's simply allowing yourself to retrain yourself to be able to cope with these situations, to allow your body to repair itself naturally. So I would say to everyone, give it a go if you find yourself in this similar situation. What have you got to lose? You will see improvements, you will get better. As I said, the number one thing is to put yourself first and learn to say no. First of all, if you're looking to recover from chronic fatigue, I'd suggest that stop looking for a reason why, stop looking for or waiting for medical treatment to come to you, and try this program. You can actually control getting better yourself, and you will get better if you follow the steps, lower your expectations, and really build slowly and be kind to yourself and allow yourself the time to be able to repair. I've got the type of personality that I always want to help people. Whenever anyone asks me for help, I'm there for them. I always want to do 100% work. I'm always trying to overachieve, get things done, push myself when there's deadlines, and unfortunately that hasn't helped me with my health. And in understanding this process, I've been able to understand it's okay to say no, to take a step back, and people aren't going to be upset with you. They understand your health has to come first. And going through this whole process, I've been able to really understand and be able to pace myself better, and I hopefully be able to transform that into my new business and very much be able to continue to have good health for the rest of my life. So if I look back to where I was only just a few months ago, 5 months ago, and I was virtually bedridden, to where I am now, it's just an incredible transformation. And I wouldn't have believed it was possible. Ashok just said, look, just be patient and it will happen. It will happen for you. Just trust in the program and you will get your life back. And I am. I'm 90-95% better now to what I was when I was in my early 20s. So I'm just looking forward to the future. It's just brilliant.